When we have a simple classification of insufficient ridges, we have basically four types of problems. We have to deal with the socket, okay, immediate implantation versus socket preservation, the low ridge, and basically we have some options to deal with this, namely the short implants, the tilted implants, the traditional GBR, the blocks, and some techniques that manipulate the inferior alveolar nerve that I'm going to show in one clinical case, that are the trispass, the lateralization, and the transposition. That are three different techniques, but that deal with the inferior alveolar nerve. The thin ridge, and basically we have very wide of range of techniques, but basically we have the ridge split, the GBR, the sausage technique, the Taj mesh, and the mini implants. And with the maxillary sinus, or we graft or we avoid, and we have basically the crestal lateral approach to avoid the sinus with tilted implants, or even sometimes the short implants, and in extreme cases with the zygomatic implants.